Nagyon nagy szeretettel köszöntök.
I warmly welcome you, colleagues, friends, and I'm honored to say hello to those who are here first. I'm a medical doctor and economist, and my only task today is to describe shortly what we are going to talk about and to introduce our speaker. I remember about 10 years ago, I read an article about Australian specialists who examined joint pain, and they started to use a new therapy, and it was fecal transplant. And I know it can sound strange, but they determined that people with autoimmune diseases, they got this transplant and they could get up from their wheelchair. And I remember there was a congress, and I spoke about this, but people smiled and only just shrugged their shoulders. Today, it's a routine procedure in Hungary, and there are several conventions about your gut flora and how to fix it. And it turned out in the last 10 years that our gut, the composition and quality and quantity of bacteria is strongly related to diseases. There is a link between your gut flora and your health. And there is another milestone today, because it also turned out that the quality of your microbiome determines how you feel in your skin, how we think about the future, and how creative we are, and how we are going to live a few years from now. And a friend of mine, who is a self-made man, who graduated as a pharmacist, and then as a pharmacist, he decided that he did not want to deal in drugs. He wanted to heal drug-free. He is researching, he's developing things, and he's healing people. And we can feel honored to welcome him every month to hold a Health Academy lecture for us. And he gives us incredible information. And now, just grab your seats, because his lectures are really, really moving and shocking. And you will need a pen and paper to take notes, because the information he's giving us is very valuable. So let's welcome Dr. Szűcs Zoltán. It's over to you. Hi, thanks for this introduction. And I warmly welcome everybody here. It's a milestone that we are going to talk about today. And this is a milestone in medicine. This is a milestone in the Health Academy, because we can summarize what we have been talking about in previous lectures. There is a straight line which leads us to our gut. I think that the human body is an incredibly sophisticated and very conscious machine. Nothing happens without a reason. We can examine decades, and then we realize that there are very straightforward solutions. But by the time we realize that in real life, it takes a lot of time. And these lectures are the best vehicles to talk about those that we can use. And you wouldn't think how simple things can influence the gut-brain axis that we are going to talk about. In my life and in your life, not a lot of time is dedicated to looking up medical trials and articles, but believe me when I say that on a daily basis, there are articles published by the hundreds or even thousands every day, which we should learn about, and it takes time to put them together, to draw the conclusions. So today I would like to talk about a topic, and you can see this, which gets as a subtitle, how our gut communicates with our brain. We can interpret it as a gut-brain axis. And I would like to also touch upon some fashionable symptoms and diseases. We always talk about them, which are neurological, which have neurological symptoms or produce neurological symptoms, but they are deeply rooted in problems in the gut, an unhealthy gut. So I will talk about all kinds of diseases, but my purpose is not to recommend solutions to diseases. I would like to give you information. First of all, what you can see in the picture, this is a very complex system containing close to 1,000 types of bacteria, viruses, and pathogens. You know that we are just 1/10 human, because we consist of 90% bacteria. This is strange to say, but it's true. The unity, the symbiotic unity that that our body is working with, bacteria and viruses, this is capable of controlling, monitoring human function as a whole. And as Tamás said in his introduction, this is not a question anymore. There is a gut-brain axis. We know what is happening. These are all known data, this two-way communication that happens between the two. So the way we process the food that we eat, the way our enzymes work, the gut flora that exists in our body, there is a control mechanism exerted by the brain when you are hungry, when you are thirsty, the warning signs that you receive via your nervous system. We will talk about this. And on the other hand, your gut and digestive system determines, and the flora there determines the enzyme interactions and how food is absorbed, determines your behavior, your habits, and your gut determines what kind of person you are Is this true? To a degree, yes. It has a huge impact on your personality, on your behavior, on your patterns, your psychological state, and how you can respond to stress, how you can process information from your environment, how you can adopt it, and how you will react to it. Your digestive system and your brain are in two-way communication all the time. This is the gut-brain axis. When I prepared for this lecture, this lecture is not for professionals, and I wanted to include things which are interesting to professionals, but I wanted to address the man in the street, the woman in the street, how significant all this is. So I used a multi-approach style. I also studied the international magazine Nature, which is a very serious scientific magazine. And I just started to search among the articles. I just typed in gut-brain axis. From the previous years, there are 700 studies which were published in Nature alone. This is the subject of ongoing research. Medicine and the food industry are actively contributing to these research projects. There are certain strains of bacteria when they overgrow, and or when some of them are not present, which means there is an imbalance in the gut, it will lead to more frequent occurrence of certain diseases. So it is critical to have probiotic and prebiotic foods, and you take living stuff in your system, which will change your proneness to illness. It will change your way of thinking and your metabolism as well. I will also talk about, let's call it ADHD. Many people have heard about the word, this abbreviation. When I said at the start of my lecture, when I said that we use a lot of medical terms, medical lingo that we think is a disease, ADHD is such a term. It's attention deficit disorder. It's a behavioral disorder, usually in children under 12. But in adult population, it is also present. This is not easy to describe. However, what is so common? I collect a few things. This is just a syndrome. In my eyes, this is no different from other lifestyle diseases that we have covered so far. Attention deficit disorder, this pattern of behavior, change in habits, behavior, this is directly related to diseases of civilization. This never used to exist before. And there are changes, lifestyle changes behind it, and inflammation in the neurological system. There are problems of absorption, having to absorption in the gut. And there is autism, where neurological and digestive symptoms are hand in hand. Certain foods, there is intolerance towards certain foods, and other foods improve mental function. So what is it if not brain-gut axis? And there is an environmental load and the huge amount of environmental impulses. Family background is very important. The stress which children are exposed to, but children react differently from an adult. Scientists agree that there should be some kind of genetic predisposition to such a disease. Such genetic makeup is okay. Certain people have weaknesses in their heart, in their digestive system, but this is not a disease. There is a genetic makeup that you have, but the way you live your life, the foods that you eat, the way you look at life, this activates your genetic codes, or this is what can deactivate your genes. These are environmental factors. This is you with your stress, with your diet, and so forth. ADHD as a disease, only specialists can recognize this and diagnose this. Many children can have similar symptoms. There are pages and pages of descriptions of symptoms that your child cannot concentrate on things or cannot concentrate properly, daydreaming. There are many things they are interested in, and there are things which he or she is interested in very much, and there are everyday things that they are not interested in at all. Learning problems. There are pages of descriptions of what symptoms could be diagnosed as ADHD. I could say, I could diagnose my children, my own children in the other room. Maybe they belong to this category. No, they don't. Make no mistake. When there is a step diagnostic process that specialists go through, and the symptoms that our children live with today, these are caused by today's lifestyle. We can change some of the things, and this is not a disease. These are harms of civilization, I would say. So the solution is and should be a very complex method, the way we should treat cardiovascular or digestive problem in a holistic way from multiple angles. So let's use a multiple directional approach. Why is it that our digestive system is suffering in the 21st century? Because we take a lot of foods which cannot be digested or which inhibit the enzyme there and which overload our gut flora. This overload is so huge that your gut cannot balance it out, and these are the food products that I'm talking about, these processed foods. So I just go back one slide. When you eat foods, when you take foods which have beneficial effects on it, suddenly the balance is restored. Imagine that there is a cause and there is an effect. These are compensational reactions in the human body. Compensation serves the purpose to neutralize the cause and to create a new balance, which should be a long-term balance if possible. If the original stress is so strong that the compensational reactions, neurological, hormonal, dietary, and so forth, these reactions cannot create a balance, then there will be a prolonged imbalance, and this is disease. The human body, these buffer systems can create these balances in various systems. Your psychological and your physical reserves from diet, vitamins, trace minerals, antioxidants will feed or prebiotic fibers which feed your gut, omega-3s and other fatty acids. These help. If we go on and one step further, what should we do? Well, the Zinzino Health Program has a message. Have a varied diet and find the diet that is best for you, which should be unprocessed. Do not overload your system with processed foods, and take as many natural foods as possible, nutrients from such food. It's interesting to note ADHD, I will keep talking about, and also the brain-gut axis and the problems of that. So in autism, it is shown that gluten sensitivity is very, very high. And on a broader scale, in each patient who is autistic, and all autistic patients who has neurological symptoms, most often there is protein sensitivity present as well. Gluten is a protein. You can tolerate it or you won't tolerate it. My own body can tolerate it, and maybe 70% of those of you who are here with us, your body can tolerate it. But there are those who cannot eat bread and pasta, glutens. They can feel it. Some people have such a so this process goes so far that their blood work also shows it. But when we are talking about attention deficit disorder, then gluten is a very common problem. Why? Because this is your digestive system and the internal wall in your small intestine. The food that you cannot digest because there are not enough enzymes, gluten creates short little gaps in your gut wall, and so this is the leaky gut syndrome. Gluten as an allergen gets through, and if you are genetically predisposed due to this genetic mutation, you will get an instant immune reaction, and the killer T cells will start to hurt your own cells. This, as a result of this allergen, you will feel this in your brain, in your liver, in your pancreas, in your skin, in your thyroid. Autoimmunity and all these diseases and neurological, hormonal, autoimmune symptoms have gluten behind them or similar stuff, allergens. Also, there is an interesting phenomenon, and this undigested protein gets through your gut wall, gets into the blood, and there are morphine-like chemicals, and it gets through the blood-brain barrier. These allergens and the inflammatory reactions get into your brain. And where did it start? We started from eating gluten, and we get to the point where the problem attacks your brain, and then it creates a certain addiction or allergic reactions, pain, and 1,000 other bad things. It goes without saying that if you take gluten into your body, which is everybody, depending on whether your digestive system can tolerate it or cannot tolerate it, you will develop certain diseases. I know the letters are small, but I will detail them. So this is chronic fatigue syndrome. ADHD is there, and poor concentration, neuropathy, depression, anxiety, restlessness, restless leg syndrome, headache. These symptoms are linked to gluten intake. So from the viewpoint of your diet, you should try to get rid of allergens. Eat a diet that is gluten-free, casein-free, which is milk protein-free, and then you can experiment and you can feel the best way for you. You should take whole food. In most cases, you should supplement your diet with vitamins, minerals, a lot of antioxidants. And this is what Xtend can do for you. This is a very complex formula. It supports your immune system, the normal function of your immune system. Autoimmune problems are not normal functions, and you need all these vitamins and minerals to function well. You need amino acids, and you need enzymes to break them down that you need to take with living food, raw vegetables, fermented food. When we talk about Xtend or Xtend Plus, we can always mention this product, and our subject today is no different, because for neurological processes we need all kinds of vitamins, minerals, and the way to take them is through diet. But our diet is the number one problem. In most cases, you need some supplements. That's why we always mention Xtend, because it's a full spectrum supplement. Let's also look at the brain-gut axis from above, from the switchboard. Your brain, which sends orders, directions, signals. When these orders, these signals are normal, then there is no problem. But when in the brain biochemical processes will change because of stress, and we have covered this before. So as a result of stress, neurological transmitters are produced in a different manner, and the ratio and quantity is different than normal. There are serotonin, dopamine, and there are others too, adrenaline, noradrenaline, GABA, and there are others. The ratio will change. And it's a fact now that the gut-brain axis, when there is a problem, dopamine levels will rise significantly. And this will influence something negatively. This will decrease serotonin production. These hormone-like chemicals, neurotransmitters, will influence your behavior and mental health. What's more, your function, your hormonal function in depression, and it's very closely linked here. In depression, the same thing happens. Serotonin levels drop. You will see later there are a few causes. Stress is one, which will decrease serotonin levels directly. And the other cause is in the gut. So in these symptoms, brain biochemistry is changed. And when it does, the signals, the orders to your digestive system also change. This happens on various pathways. This is a stress hormone. So these stress hormones will be released. Your gut flora will change for the worse. And your gut flora is very sensitive, very, very sensitive indeed to stress. It will create, stress will create a very different environment in your gut. And certain players in the gut will like it, others will hate it, cannot even survive it. And in certain diseases, your gut flora will be different, will change, and its whole function will change. For example, it won't produce 5-HT, which is a chemical which is the precursor of serotonin. So in your small intestine, serotonin will not be produced. What is serotonin for? There should be a good balance, a mood balance in your brain, so that you can pay attention and so that you are not depressed. So there is a disorder in serotonin production. 200 times more serotonin is produced in the gut than in the brain. But the serotonin produced here will be used or would be used in your brain. Also, your immune function will change. It was a topic earlier. Your gut flora will not produce certain fatty acids. Your fat metabolism will change. There will be problems. GABA is a very important amino acid, cannot be produced in enough quantity. So we examine what goes down from your brain. This is the serotonin problem. Serotonin should be used in your brain, but it cannot be used in your brain because it's not produced. And therefore, your brain processes will change and your behavior patterns will also change for the worst. And stress will directly pressure your digestive system through your sympathetic system. It will change the metabolic rate. There won't be enough enzymes. Your blood vessels will constrict and absorption will be decreased. Whatever you will eat, they will not be used by your body. So this is how stress influences your digestive system indirectly. There is another very scientific figure here. This is what we call the second brain. This is the digestive system, or more exactly, the neurons in your digestive system. The most neurons are housed in the brain, but the second most are in the digestive system. This is a very, very important relationship. And as I said, they always communicate with one another. This is an autonomous neurological system. It can work alone, but it also gets orders from the brain. You cannot consciously influence, for example, the rate of your digestion. You cannot do that. These neurological pathways will influence it. So stress can affect many things. You can see bile acid malabsorption, immune function, hypersensitivity to food, and the neurons, the neurological system in your gut, your hormonal system, serotonin. It will change the composition of your gut flora. Some germs will overgrow there. How to handle stress? The quality of sleep is very important. To recover, to regenerate, it's very important to have a stress handling mechanism. It can be free time, it can be whatever you feel good about. If you need help, then there is help. Viva is such a tool, which is a saffron extract, among others, and this is an adaptogen which helps your body tolerate stress more. The impulses we are exposed to, we can process them more when there is an adaptogen present. So this is Viva. This is why I think that today, and especially at this moment in time, under these circumstances, we should handle and cope with stress. If we go into details about what happens in the gut, you know already, because I have already talked about this before, that for normal digestion, we need a logical system, step-by-step system, food which is high quality, which nourishes you, which can be digested, very important, truly beneficial food. You need hydrochloric acid, bile, you need your small intestines working well so that your cells can be nourished. Hunger, diet, eating, food, processing our foods by our enzymes, your calorie and energy balance, your the hormonal system influences all that. This is not new. This figure shows the same stuff from another aspect. Not only hormonal and neurological processes influence your gut, but there is hypothalamus in your brain, which is from your gut, and hormonal impulses as well. This is what is processed there. The brain is aware of everything, and there is feedback about everything. So your brain tells you when to eat, and the smell, the taste of food, the sight of food will trigger all kinds of reactions so that your body can prepare for taking food. If this works well, this will be a normal process. If this doesn't work well, though, this chain will not work at all, because you won't have time to eat. To eat food, you need time. You need to be calm, and you should not talk on the phone, and you should not be exposed to stress while eating. So there is poor digestion. I just highlight one thing. So what did I say when I was talking about gluten? There is an immune reaction against gluten. There are many other stuff which are not digested that trigger such reactions. This is persistent inflammation. It depends on how stressed you are, how good your diet is on that particular day or during that particular week. This is always emotion. The more food you eat which helps your digestion and your immune system, the more positive your body's reaction to inflammation will be. The other axis, which we could also describe as a gut-brain axis, but this is the communication between our immune system and our brain. Because when you are exposed to stress, there is a hormonal reaction, and in our blood and in our digestive system, there are white blood cells which perceive that you are exposed to stress. The stress hormone is perceived because they have a receptor to it, and immediately immune cells will produce certain chemicals which your brain perceives. This is also a link which goes back and forth. Your immune system can give feedback about the state of your digestive system. If there is inflammation, that's what it will signal to the brain. So the things that I have covered so far, and you can check the data on the internet, but go to authentic sources, databases where specialists publish articles. Nobody has any doubt about the gut-brain axis, and this is very significant. discovery. If your gut flora is healthy, this is eubiosis, which means good biosis. If these bacteria are in good balance, this means life to us, because they clean up things, because they produce vitamins, they convert things, they help absorption. Without them, no life is possible. If there is imbalance, which is called dysbiosis, out of balance gut flora, full of toxins and parasites, this creates inflammation and lifestyle diseases, all kinds of them, any of them. Autoimmune diseases, ADHD, high blood pressure, cardiovascular diseases, diabetes. In fact, all of them are linked to the digestive system. We know that eubiosis, which is healthy gut flora, and dysbiosis, which is an out of balance gut flora, it determines if you are healthy or ill. There is no doubt that there are links between the diseases which decimate the society today. They are linked to dysbiosis. Tamás said in the introduction that people can get the fecal of another person, and this can heal, people, and this is used in medicine today. We consider these autoimmune diseases incurable earlier, but we should not just talk about this. We can say let's change our gut flora and make it healthy. But I don't know the composition of my gut flora, but what I do know is that there are certain foods, nutrients, which a healthy gut loves, and there are those that harm your gut flora. So we should prefer foods that promote balance. That's when your metabolic disorders and obesity, insulin resistance, diabetes can be handled at the root. There are structural functions and protection functions of the flora. This is where 80% of your immune system is housed. I would say 100%, but medical literature, it says about 80%. Okay, I need to agree. So these are the bacteria will protect you from germs, and they produce certain beneficial chemicals, and this is very important for you to stay that way if you want to be healthy. There are many kinds of bacteria, many strains of them, and their composition and their ratio is what determines what is healthy and what is not healthy. I don't want to go into details because this is very it's a very complicated subject, and there are various schools of medicine which which say different things, but there are research projects which prove that in certain diseases, certain bacteria strains are good. So the way to the future is to help your gut flora with probiotics and prebiotics. And for pharmacy and medicine, this is something that they will do, because there are drugs which are patented. That's their stuff. And again, talking about the neurological aspect of your gut flora, it has to do with anxiety, depression, schizophrenia, autism, Parkinson's. If you just look at these, when they created this, they didn't include ADHD, but it could have been included, and other kinds of neurological problems. If we take foods which have high prebiotic value, which can be the fuel for your friendly bacteria, what you do is to restore balance in your gut, and you prevent the problems related to stress and diet, which caused the imbalance originally. I cannot tell you which strain of bacteria can decrease or increase exactly, but what I can feel that the gut flora, which creates eubiosis, which is balance, they feed on prebiotic fiber. If I feed the gut flora, that part of the gut flora which is healthy, then this balance can be restored. That's why prebiotic stuff is so important. I'm not talking about probiotic stuff, which are strains of bacteria, and that's where xenobiotic enters the scene, because it's a blend of 8 dietary fibers, which has which can feed good bacteria so that they can grow. And these good bacteria eat it, and that's what I mean. They actually eat it, and these fibers in xenobiotic, there are 8 of them, and these fibers will help certain aspects of your gut flora. Also, lean shake should be mentioned here, because in today's world, very high-paced world, it's very difficult to take whole foods, and in some cases makes it even impossible. You cannot go to a restaurant even today. So if we have a meal replacement powder, which is called lean shake, you can take it. In 1 minute you can make it, in 1 minute you can take it. And it contains all the stuff, the good stuff that I have mentioned so far. In closing, as our last topic, I would like to talk about the neurological system, digestive system, and the cells which make up these systems. Each and every one of our cells, in order to function well, they need a stable cellular structure. This is what we call a cell membrane. This is what surrounds cells. the interface that the cell uses to communicate with the outer world, the fluidity of cells or cell membranes, and how stable it is, how well cells can communicate with each other. If the quality of your cell is bad, if the cell membrane is not good enough, then they cannot even communicate correctly. If it changes for the worse, it will change bad structure, and this depends on what fatty acids constitute your cell membrane. If there is a lot of omega-3s, then your cell membrane will be high quality, and these cells can prevent allergens from entering your bloodstream in the gut. And what will disrupt normal function? Omega-6 fatty acids will do that, which are a lot in our diet today. This will change membrane fluidity. It will change the stability in your neurological system. It will cause inflammation. But omega-3s can handle this problem. Balance oil is the central part or the foundation of the Zinzino health program. Will reduce inflammation on a cellular level. Your cells are renewed continuously, and there is programmed cellular death, and it will be reborn, and it will be created from the building blocks present in your blood, in your body. If there is a lot of omega-3, then it will be reborn from a lot of omega-3, which will create bad function. 10 trillion cells we are talking about here. If there is enough omega-3, then it will be incorporated in new cells. Your cellular functions will be healthy. This is a complex product which contains antioxidants as well, polyphenols, which protect omega-3 as it is in nature. If you take about 10 milliliters of this balance oil, which contains EPA and DHA, which is about 2 grams of EPA plus DHA, but omega-3 total is about 2,500 milligrams. This is a lot. This is a very targeted product. Recommendations by WHO are lower than this, but you should know that a healthy diet, if you are on a healthy diet, you don't need such a huge amount of omega-3s, but if your diet is not in balance, is not good enough, you need more. I also looked at scientific literature, recommendations and references. For example, ADHD, what kind of supplements and foods are recommended besides those that I already mentioned? 2,000 milligrams EPA and DHA, omega-3s. That's the daily dose in balance oil, because cell membrane fluidity is improved and your metabolic function will be better. Zinc, which is a very important component of neurotransmitters. It inhibits dopamine surplus, and hyperactivity is decreased. Magnesium. Magnesium in ADHD, you need more. You cannot have too much, because a lot of magnesium is absorbed and processed and used up by the body in ADHD. Pro and prebiotic foods. Autism in ADHD, IBS, in anxiety symptoms, depression, you need these foods. And there are more and more articles published about gut, how to influence your gut, and how your gut will improve with pro and prebiotics. Vitamin Bs are used up in incredibly high amounts, and there are iron absorption problems as well. As my previous lectures, this one has focused on prevention, raising awareness about the valuable tools that we have in our hands that can influence metabolism, all kinds of processes in the human body, processes which can lead to diseases. So the method to use is to change our habits, your attitude toward health, and Zinzino can help you a lot. And my lectures with the products, the product portfolio, the methods, and the testimonials that we can share is all part of this. In closing, let me quote the Dalai Lama, who, when asked what surprised him most about humanity, he answered, man, because he sacrifices his health in order to make money. Then he sacrifices money to recuperate his health. And then he is so anxious about the future that he does not enjoy the present. The result being that he does not live in the present or the future. He lives as if he is never going to die, and then dies having never really lived. This quote is very close to my heart because it's about today, now. Prevention should be started right now. Already today, you can do it. Yesterday is past and tomorrow can be far away. So I thank you so much for your attention. Wishing you good health. Take care. Good night. Goodbye.